occasion of World COPD Day, which is chronic obstructive pulmonary disease. My name is Isha Mathur and I'm leading the PR and communication for Apollo Health and Lifestyle Group. To begin with, let me give a bit of background about COPD to our audience who have joined us. Every year, we recognize this day and raise awareness on COPD, on chronic, or I should call it chronic obstructive pulmonary disease, as it reminds us of growing global challenge of progressive lung disease that causes airflow blockage and breathing problem. COPD is now one of the leading causes of illness and reduce the quality of life worldwide. And in India, the burden is especially high due to the factors like uncontrollably rising pollution, smoking, occupational exposure, and even indoor air quality issues. What makes COPD particularly worrying is that it is mostly silent. People tend to dismiss early symptoms like breathlessness or persistent cough, assuming that it is age-related or due to busy lifestyle. By the time many seek help, the disease has progressed, and this is why education, awareness, and timely medical guidance are so important. That's exactly the purpose of today's session. Before we start, I would like to give a brief introduction about Apollo Spectra Hospital. At Spectra, our focus has always been on specialized patient-centric care through expert doctors, advanced medical facilities. Today's discussion is part of our ongoing commitment to empower patients with accurate, practical, and reliable health information. To introduce our panel, we are honored to have joined by three distinguished pulmonologists from Apollo Spectra Hospital's Chennai region, leaders in their field with years of clinical experience in managing respiratory diseases, including COPD. Dr. Sai Kishore, consultant pulmonology, Chennai region, has close to 2 decades of experience. Doctor is MBBS, FFCP, and holder of diploma in tuberculosis and chest disease. A warm welcome, sir. Dr. Aishwarya Rajkumar, she is MBBS, MD, pulmonary medicines, and has an experience of more than a decade. And Dr. Indranil Banerjee, consultant pulmonology, Chennai region. Dr. Banerjee is MBBS, MD, tuberculosis and respiratory medicine, DNB, DIP, AAI, and also did a fellowship in interventional pulmonology, critical care, and sleep medicine. Thank you, doctors, for being with us today. With your day-to-day experience, your insight not only help our audience understand COPD better, but will also guide them on how to manage symptoms, reduce risk, and improve long-term lung health. To our audience, thank you for joining us for this special awareness session. This will also be streamed live on our social channels, including Facebook, LinkedIn, and YouTube. This video will also be saved for you to watch later or send it across to somebody who think would require to see this. Without any further ado, my first question would be for Dr. Aishwarya. Let's get started, ma'am, by first understanding what COPD truly is and why early diagnosis is so crucial for better outcomes.
See, first of all, as the name says, it's a chronic obstructive pulmonary disorder. So, a major difference between any other lung issue and COPD is here, whatever damage has happened, it's not really going to be a reversible issue. So, this is because of a long-term exposure. When we mean chronic, it's something that has happened over the years of, say, someone smokes or an occupational exposure, or just by even air pollution. So, someone who's been subjected to a long-term damage to the lung is the one who gets a chronic obstructive pulmonary disease. So, there's a common misnomer that COPD comes only for smokers. No, it can also come for non-smokers. And when diagnosed, from then on, we kind of treat these patients so that the lung condition does not worsen further. So, that's what COPD is. So, it is a chronic disorder. When patients present to us, they would have been having issues of cough for like almost negligibly a few years, and they come to us when the symptoms get really worse.
Right, absolutely, Dr. Aishwarya. Thank you. Thank you for setting the context for making each one of us aware about COPD and how timely diagnosis is absolutely crucial here. Moving ahead, my next question is for Dr. Indranil. Sir, it is said that, or rather I would say perceived, that smoking is the biggest cause of COPD, and like Dr. Aishwarya also mentioned. But we would like to understand from you, what are the other risk factors that people often overlook, such as pollution, occupational exposure, or indoor smoke, that could be a reason for COPD.
Yeah, so I think you've already mentioned the other contributory factors other than smoking. So, indoor pollution, biomass exposure in a country like India, where most of the population is rural, they have been exposed to a lot of biomass, chulas, cooking in that. Then a lot of passive smoking, indirectly from cigarette smoke, from car fumes, and another thing is industrial pollution also contributes heavily to COPD. So smoking, yes, definitely one of the primary etiological factors of COPD. That's true, but there are other major factors that contribute to COPD in everyone's life.
Right. This was a discerning fact that you shared, Dr. Indranil. Thank you for letting our audience know about the big role that other factors play. The point raised by you advances us to a crucial question. I have been in Delhi for a longest time, and people act like breathing the smoke is just a workout for our lungs, or a survival of the fittest strategy, since they have been they're not planning to leave anyway. So it seems that they feel that there is a prevailing belief that we are building a toxic immunity rather than suffering the damage. Due to this mindset, many patients also delay seeking help because they think breathlessness or coughing is, normal with age. Dr. Sai, I would like to understand from you what symptoms should definitely not be ignored, and what tests are needed if someone feels troubles in breathing, or see these early signs.
Yeah, good afternoon, everyone. So it's a very interesting question. Basically, the COPD is accompanied by cough, breathlessness. So, differentiating cough and breathlessness in an elderly patient, there is a few considerations, key considerations, like the breathlessness is on exertion. When you have the slightest movement, you have breathlessness, or the timing. It can be there in the early mornings. The cough can be accompanied by breathlessness with an audible wheeze, which everyone understands about expiratory wheeze. So when you have these three things, the small things like uh, unable to walk to the toilet can be a key indicator for our saying that something is wrong with us. So differentiating COPD and other comorbidities also plays a major role. We need to find out what are the comorbidities the patient has with cough and breathlessness, like congestive cardiac failure, pulmonary edema, or asthma like thing. So, how do we differentiate between this cough, breathlessness in a COPD and other comorbidities? The simple things like chest X-ray would rule out a pneumonia or some lung cancer. A pulmonary function test, which we call as spirometry, we do an FEC and FE1, and that ratio will be a clinching diagnosis. The third would be a CT scan imaging and an arterial blood gas analysis to us understand and assess the oxygen level. Basically, the most important to diagnose, it's a key controlled history and prolonged examination would clinch the diagnosis.
Great. Thank you, Dr. Sai. Understanding these symptoms, I think, play a crucial role for people to act upon quickly. We often see patient worsening during winters and pollution-heavy days. What preventive steps, or should a COPD patient take during seasonal changes? One, short-term exposure to such toxic air actually triggers or accelerates COPD, otherwise for a healthy individual. Dr. Aishwarya, if I may request, you can answer this question.
Yeah. I mean, you were just mentioning that even you were in Delhi for a few years, and so in a place like that, and even I was in Delhi for a couple of days ago. I just went with a very mild sore throat, but I ended up coming back with a bad bronchitis, which is coughing very badly. That is because the Delhi smoke kind of, triggered the whole sore throat into a bronchitis for me. So, say if you're already living in a region where there is a extreme pollution, or winters like this, in an extreme sunny place like Chennai, where suddenly the temperature changes during monsoon. One thing that I would always tell my patient is, say, if you already have a pre-existing lung issue, let's leave COPD, this part COPD aside, but say if you already have like a wheezing or an asthma, or as simple as you're an allergic person, where you easily get a running nose, there are a couple of things that you have to do. One, just before the monsoon starts, it's advisable to take a flu vaccination. This is advisable for everybody, even children can take it. As early as 1 year, children can take, and all of them per se can take. And in our country, it's mandatory for the children, still on the pediatric vaccination schedule, but for adults it's not. But we always recommend taking a influenza vaccination annually. And two, if a patient is already on inhalers for a set lung condition, or you're on any nasal sprays for your allergic rhinitis, make sure that you're on these medications regularly, especially during this season where there is climatic change or when there is a extreme pollution like in Delhi right now. So during such seasons, it's better to take and be on your medications very regularly, or to even start on these inhalers when you feel like your symptoms are starting up. And if you start experiencing, say, a mild sore throat or a cough, this is a flu season, and most of our patients come to us only when they have like a very bad cough for 10 days. I would say come much earlier so your symptoms are not worsening with the climatic conditions or the pollution.
Right, absolutely correct, Dr. Aishwarya. You brought an interesting point here. How healthy individuals are severely impacted. Dr. Indanil, I would like to understand from you what lifestyle changes, including exercise, breathing techniques, or home management practices, can genuinely improve quality of life for someone who is living with COPD or live in an environment which is susceptible for developing COPD.
Anyone around that patient who is smoking needs to definitely be away. That is one. Any kind of exposures that patient is having to any kind of smoke, not only cigarette smoke, should be curtailed. Pursed lip breathing, respiratory exercises, then incentive spirometry at times. Then a lot. Then when it comes to the diet, it should be a high protein diet. A patient who is on COPD, definitely his or her chest muscles become very weak and they are unable to expectorate sputum also, and that causes further complications in COPD patient. A lot of vegetables can be added in the diet, high protein diet, breathing exercises, and also exercise, a bit of exercise daily, whereby there is muscle endurance and strengthening that keeps happening throughout for the patient. Other than that, obviously the vaccinations, as ma'am mentioned, is compulsory. It should be taken. COPD patients definitely should be vaccinated against influenza. Recently, also with respiratory syncytial virus vaccine and also pneumonia vaccines. The latest one, that is Prevnar 20, that has been launched. The patients should be taking that.
Right. Dr. Inleen, you just said that, exercising is crucial, not heavy, but probably a little. Do you think that a lot of people are saying don't step out? So any, two exercise or smaller exercise that people can pursue at home, just a little walking will help. If you can maybe give two pointers for our audience to, understand what kind of exercise they can pursue.
Pursed lip breathing, definitely, and deep breathing exercises, thoracic breathing. Those are two definite ones that can rather than walking and muscle strength, because whenever your lungs get a lot of volume to exercises pertaining to that, yoga also helps. Treadmill exercises like
Right.
If I could just add to Dr. Indranil's point, I would recommend all my patients to keep doing pranayam yoga. It's a basic form of breathing exercise in our yogic forms, and it really does wonders for anybody with a lung issue. So every day, 10 minutes of pranayama yoga to start your day with is a great form to go about if you have any lung issues.
Right. Thank you, doctors. I think great point that you both brought in, especially in terms of exercising and the kind of food that one should take. For example, protein and fiber-rich diet. Dr. Said, if you can help us understand this, a lot of people say or feel that mask doesn't really help against pollution. And for COPD patients, prevention, what actually works? A cloth mask, N95, or nothing at all? It's just a gimmick. We would like to understand that from you.
Wearing a mask reduces the exposure to the air pollution, which contributes to the COPD symptoms and the progression. So, if you can use a good mask, N90 or an N100, which are very good masks, which filter very fine particles, which will help us in reducing the exposure to the air pollution. Basically, how we are going to advise people to avoid the air pollution is, we have to go in the car or on the bike to the office every day. So you need to find out your local quality air quality level. See, everyone has a smartphones now, so if you can get in your phones and see what is your air quality level, we'll be able to assess which area is very highly polluted, and which time which we can go into the outdoors. Strictly wear an N90 or N100 mask during the polluted days, and avoid uh, when there is a spraying of a pesticide or a chemicals near to you. You can wear a mask during that time. And post COVID, I think we are allergic to masks. We have been wearing it for 24 into 7. So now people are very scared to wear masks. So these are the most three areas which I recommend to everyone to wear a mask. And basically for our healthcare workers, when we have this kind of flu pandemic going on in all over the world, so we are supposed to have the health workers should wear a mask during examining the patient.
I think this is a very important myth buster that all of us have, thinking that it helps or it doesn't help. One thing that I would like to understand from you, Dr. Aishwarya, you mentioned that it's regular. It's important to take your medicines regularly. Is it true that even COPD significantly increase the risk of heart disease? And how do conditions like hypertension, arrhythmias, or heart failure interplay with COPD?
So, to put it in a simple way, the organ lung as such, the work of the organ is like, say, it's basically like a charger to your phone. So the oxygen supply the lung produces, that is, it takes in the air and filters out the rich oxygen and sends out the rest of the air. So that's the work of this organ per se. And this oxygen is essential for every cell in your body, which practically means to every organ to function properly, you need a good lung. So that's because that's where the oxygen from the lung is carried on through the bloods to the other parts of the body. So say if this is not performing well, which means the oxygen that's carried on by our blood to the rest of the body kind of goes down. So it impacts on every system. So on a vascular level, it impacts every system. And the most affected organ, because it works hand in hand, is heart. So say if a lung is not going to have sufficient amount of oxygen that's being pumped to the body, then the heart also takes a strain on pumping. So invariably, a patient can develop a pulmonary arterial hypertension. So which is secondary because of low oxygen in our body. So we call it hypoxate, which kind of creates a pulmonary arterial hypertension. And likewise, every other organ can be impacted. That's why I tell my patients, so this is basically the charger to your phone. So if you want your organ to function, so if you want the phone's battery to be good throughout the day, you need a good oxygen in your system throughout. So if that's not there, then it slowly starts impacting on other organs.
Right. Thank you, doctor. Dr. Indranil, if you can help us understand that, pulmonary rehabilitation often involves physiotherapies, therapists, dietitians, and respiratory therapists. How does the team approach improve the outcome?
Who have chronic lung diseases are advised pulmonary rehabilitation in order to alleviate their symptoms, not mainly to reduce cough per se, but it is a multidisciplinary action that is undertaken for the patient, whereby physiotherapists help in giving exercises, the pulmonologist prescribes the medications that are required. Then then psychiatrists are also there, psychologists are also there, because a lot of COPD patients undergo depression and anxiety also, that being a major factor that affects COPD patients. So all of that overall holistically is taken care of by a pulmonary rehabilitation team. So obviously it takes and the pulmonary rehabilitation course is for a minimum of 6 weeks. Then it can be done through teleconsultations as well, and it generally gives very good results for patients who are following it up well.
Right. Thank you, Dr. Indranil. To your point, Dr. Sai, if you can help us that, COPD patients often either lose too much weight or gain weight due to inactivity. How does nutrition influence lung strength and the recovery?
So this too is it's a very important for the patients to understand. I think the doctor has already told us about the endurance and the exercise, very important for a pulmonary health. There is loss of muscle wasting in our body in chronic COPD patients, which require high protein. So if you see a lot of people, we start protein, whey proteins in the treatment protocol itself. When the patient has a COPD with exacerbation, we gave him maintenance of a high protein diet. So high protein diet can come in all forms of vegetarian, non-vegetarian, and all that. And specifically, the comorbidities also should be assessed. The patient has a diabetes, has an hypertension, or a renal failure, or a liver failure. Accordingly, the protein adjustment should be made to a proper a fixed diet plan, which we can call for a COPD patient.
Right. Thank you, doctor. Dr. Aishwarya, raising or coming back to your last point, many COPD patients struggle with anxiety and panic due to breathlessness. How important, physiological support in their long-term management?
See, I mean, most, as I said, to even start with, so COPD is a chronic condition. So when a patient is diagnosed with COPD, then they will have to be on treatment. So it's not like, so asthma is the condition where you treat and then the allergies and everything settles in, they can eventually become okay and completely normal. So here it's a long-term exposure. So these patients are suffering from chronic illnesses. Sometimes even with the medications, it's because of the long-term exposure and late presentations, these patients eventually start developing chronic hypoxia, which means they have low oxygen levels in the body. So they have difficulty in breathing, especially on closed spaces. They feel extremely suffocated. And, even while doing simple physiotherapies, they struggle a lot. So there are a couple of things that needs to be done. So most of these patients will also need supports in terms of, as Sir said, they need psychiatric and psychological support. So that in a way also as a process of when we say pulmonary rehabilitation, it is also rehabilitation to mental health as well, in terms of supporting them and kind of reassuring them, constantly saying that they're going to be okay, and they will have to follow a few breathing techniques. If they feel anxious, they will have to be on these medications. That's why when their follow-ups are structured in a way that it's structured, that they'll have to visit the doctors frequently. We give them set intervals to follow up, and then when the pulmonary rehab program is set, as Sir said, we structure it for like 6 to 8 weeks, and then we reassess and we decide if the patient's going to need it for a longer period of time, because it's going to be multidisciplinary approach when it comes to COPD, because these patients need psychological support in terms of medication and support in terms of physiotherapy, mental health support, and even in terms of, we say that they need support in terms of they cannot be alone. They need support in terms of their family as well.
Right. Thank you, Doctor. Dr. Sai, if you can tell us one last thing. Every year, AQI, AQI posts go viral. Suddenly, everyone is, rushes to buying air purifiers. For COPD prevention or for management, do home purifiers or air purifiers make a real difference, or are they just, an overrated gimmick?
An individuality. There are few patients who are very allergic to dust and hyper allergic to other things. So in these kind of patients, the air purifiers may be of use, and the indoor plants, if you can say an example of spider plants or lily plants, we give pure oxygen, which helps to purify the air around you. And the other air purifiers, there are so many in the market. We have been trying to prescribe to people, and there are more than the 50% of the people have come and told me that they're doing better. The most important is a prevention of an air pollution is to stay indoors and avoid too much of exposure to whatever allergy they are susceptible, and healthy diet as high protein and a balanced meal with exercise. Keep yourself physically fit, and have a good yearly vaccination with flu and a pneumococcal vaccine, as he said, RNA 20. These are all the best ways to keep ourselves more healthier than going out and getting into the polluted areas and getting into severe COPD symptoms and progression.
This was really helpful, sir. I think this is time for a dummy rapid fire. I'm sure we recently, all of us must have seen a viral video of Brian Johnson, an American entrepreneur, walking away from the middle of a podcast conversation as he was unable to breathe. So, do you think that air pollution is an emergency, or it's time to declare it as a non-communicable pandemic, since it doesn't really show, or immediately you can't see the long-term impact that it's putting? I would request all three of you to maybe give one by one each answers in the favor yes or no, and the reasons for it.
It is definitely a real
We
pandemic
start with Dr. Aishwarya. Please go ahead.
definitely a real pandemic in our country per se. Because in terms of world's most polluted country, I think we stand somewhere about one of the fifth places. And as per the WHO standards of highly polluted countries, which is based on the PM10 particles in the air, which is from the carbon emission that's in the air. So these PM10 particles are extremely harmful, and 4 or 5 cities just from India are in the top 10 ranking of. So Delhi is apparently non-livable in terms of WHO's living standard of pollution. So I think it is an emergency. It is a unsaid pandemic right now that's going on, because over the last 5 years, as pulmonologists, I'm sure all of them in the panel will also agree with me, the number of patients with lung issues. Previously, during the seasonal times, that is, say during monsoons, we see a lot of patients, but throughout the year now, we do see a lot of patients with chronic lung diseases, and definitely conditions like COPDs are going up in India. So I think it is time to pay some attention to it.
Yes, Dr. Indraneil, maybe request your thoughts here.
Yeah, definitely. But it is more of a political decision, to curb pollution. And COPD obviously is more environmental than personal, considering the amount of industrial pollution that is there, the burning and all that of the crops, residues, and everything. So, and An individual per se will never be able to control COPD or stop it. It requires political will. It requires multi-institutional effort in order to, bring down the numbers of COPD, promoting more greenery around rather than, rampant industrialization in every nook and corner. I know it's an easy statement to make, but obviously these are factors that matter. With the amount of smoke that is there all around, it is obviously killing, and COPD is the second largest uh, killer amongst respiratory diseases, and definitely it is the third highest killer in India. So definitely, if it's killing so many people all over the country, it requires a political decision behind it rather than individualistic.
Great. Thank you, Dr. Emily. Dr. Saib, could you also help us understand what's your stance?
Yeah, as the both doctors have conquered the importance of the what you call the non-communicable disease, it has to be given more importance, and it is also going to be a multi-structural design. As he said, it's not only one man's job. As we know, that Delhi produces 10% of the COPD, Kerala 6.1%, and Bangalore is at 4.3%, and more all over the world there is a definite increase in air pollutions, and there are so many climatic conferences which are occurring all around the world to curb the how do we curb the climatic air control, the ozone layers. Everything is definitely coming into the picture now, but it's always late now. We always realize late. India is always now getting more stronger. I hope they do something fast.
Absolutely. I think we all agree to your point, doctors. With this, we have to bring the session to an end, and this has truly been an enlightening and impactful session for all of us. On behalf of the entire team of Apollo Spectra Hospitals, our audience, I extend a heartfelt appreciation to our esteemed panel of pulmonologists. We are deeply thankful, and in person, despite your demanding schedule, you were here enlightening all of us. Thank you so much. Just a quick ending at Apollo Spectra, we truly strongly believe that the future of healthcare lies not only in the advanced treatment, but in proactive, preventive, and patient empowered care. As respiratory challenges continue to rise globally, driven by pollution, changing lifestyle, and environmental factors, awareness become a strongest tool. Take care, breathe healthy, try and practice tips we all got today, and have a wonderful day. Thank you so much.
Thank you.
Thank you.